There were reports of an outbreak, but we now learn that this is not the case. Your department deals with around 700 to 900 cases of malaria every season. That's accurate?
Not entirely. Let me start off to say, yes, definitely we're not experiencing an outbreak at this stage. In Limpopo, between 2,800 and 4,800 cases are notified annually in the province. In the country, South Africa, between 6,000 and 12,000 cases are notified annually. The cases that we've seen since October in the province is part of the normal malaria season that we experience in the province, yes.
Tell us about how this year's numbers then compare to malaria cases of previous years. Are we seeing a little rise?
What we've seen in 2012-13, we've actually had the lowest number of malaria cases in Limpopo for the past 15 years. So if we compare it just with last year, yes, cases are definitely up. If we compare it with years before 2013, 2012, 2011, we actually, on average, what we expect to see this time of the year.
Tell us a little bit about changing weather patterns and how that is affecting malaria and malaria cases. And also what would be interesting to know then is the malaria hot zone getting bigger in Southern Africa?
First of all, let's start with the malaria hot zone, so to say. If we look at South Africa, first of all, there's northeastern parts of Limpopo, eastern low-veld areas of Mpumalanga, and the northern parts of KwaZulu-Natal are malaria risk areas. In actual fact, since the year 2000, these areas have shrunk considerably, and we've made huge inroads in malaria and the fight against malaria in South Africa. Just to quote some figures quickly, South Africa malaria declined from around 80,000 cases in 2000 to, as I said, less than 10,000 cases the past 5 years, and we're averaging around 6,000 to 8,000 cases the past 2-3 years in the country, yes.
Mr. Kruger, just tell us how the Department of Health, you mentioned that, you know, the interventions you have. Tell us about these interventions and how do you execute them?
As we know that these parts, as I indicated to you, are malaria risk areas, the Department of Health in South Africa has a very solid malaria control program in place, and we actually focus on a number of aspects of interventions to target malaria. Maybe just to bring the listeners into the picture, when having malaria, we're dealing with the vector, the mosquito that transmit malaria, and we also deal with the people that transmit the malaria or carry the malaria parasite. So our interventions, first of all, we heavily on malaria vector control, targeting the malaria mosquito that transmit malaria, and for this we have what is called the indoor residual spraying program in place. This is a program where officials from the Department of Health go into our communities and they spray every single household in the malaria risk areas of the province. In Limpopo, we target around 1 million houses to be sprayed every year, and we've consistently reached that target over many years. Coupled with that, we also need to deal with the parasite. And for that, we need to get our community informed about the risk of malaria in order to ensure that there's early diagnosis of malaria and prompt treatment of malaria. All the primary healthcare clinics in the province are fully prepared to deal with malaria. There's malaria tests in place at all clinics, and there's a very successful treatment available for those that do get infected with malaria.
Thank you very much for joining us today. That's Philip Kruger, who is with the Department of Health's Malaria Control Unit, giving us an update. And he says we don't have a malaria outbreak in the northern parts of the country. It's only the normal number of cases for this time of the year. So no real need for alarm around South Africa. It's something that we have well in hand. Actually, matters are improving quite a lot as far as malaria is concerned